Welcome, caregivers. In this video, we will discuss how to administer eardrops to residents. Before we begin, we'll want to check the resident's record to see if the resident has any allergies. We will then want to collect the medications from the secure storage area. Only remove medications for one resident at a time. Review the medication administration record to verify the correct resident. Medication, dose, time, and that the order is current. Next, we want to physically examine the medication and compare the information on the medication label to the documentation on the medication administration record to ensure it matches. If it matches, continue. If it doesn't match, do not administer the medications. Follow your facility policy to seek clarification concerning the medication. Lastly, we want to check the medication expiration date. After doing this, you will have performed all 6 rites. It is important to follow the medication label and administer medication at the time it is prescribed or scheduled. Read each label again and compare to the medication administration record. If it matches, you may move forward with administering the eardrops. Prepare medications for one resident at a time to avoid any mix-ups. Return the eardrops to the locked cabinet once you are finished. Now it is time to identify our resident. Say hello and introduce yourself. Hello, Mr. Jones, I'm Luke. How are you? I'm going to be your caregiver today. I have some medication to administer to you. Can I verify your name and date of birth? Fantastic, thank you. One more question, Mr. Jones. Do you have any known allergies? No? Great. Explain to the resident the medications you will be administering. These are eardrops prescribed by your doctor to treat an ear infection. Do you have any questions or concerns about this prescription? No? Great. Let's get started. Position the resident by having him or her lie down or sit in a chair, tilting their head sideways until the ear is as horizontal as possible. It's almost time to administer this medication, but first, we need to wash our hands and put gloves on. Then, cleanse the entry to the ear canal with a clean cotton ball. Clean just the entry to avoid forcing wax into the ear canal. Draw up the ordered amount of medication into the dropper. Then recheck to ensure the label on the medication matches the medication record. Administer the eardrops by pulling the mid-outer ear gently backward and upward. Then instill the ordered number of drops. To prevent contamination, do not touch any part of the dropper to the inner ear. If ordered, you may place a cotton ball loosely in the ear and allow it to remain in place for 30 to 60 minutes. Be sure to return and remove the cotton ball after the time has elapsed. Encourage the individual to stay in the original position for 2 to 3 minutes. Remove and dispose of gloves and cotton balls, according to facility policy. Wash your hands and clean and replace equipment as required. Our final steps are to document the administration of the inhaler on the resident's medication administration record. Caregivers are to include the name of the medication, the number of drops instilled, the ear in which the drops were instilled, the caregiver's initials, and any refusals and/or any unusual complaints or actions taken. Remember, any prescription medication refusals must be reported to the resident's prescribing physician. That concludes our video skills training on administering eardrops. Thank you for learning with us today. See you soon.